I'm Dr. Leanne Deland. I'm a chiropractor here in Colorado Springs. Today I want to talk about how someone can become a chiropractor. After graduation, I went to undergrad at Western Michigan University. There I obtained my degree in biomedical sciences. I have a biology major and a chemistry minor. And then after all of those classes and high level of science courses, I went on to chiropractic school in Bloomington, Minnesota. I chose Bloomington, Minnesota because it's cold, and why not? So not only did I obtain a degree in biomedical sciences, I took a lot of anatomy, physiology, biochemistry, and I thought that I was done with those classes. But then I showed up to chiropractic college. We just took anatomy and just blew it up. So what you thought you knew about anatomy, you just really learned those minute details. Something that I was not prepared for was cadaver lab. So taking human bodies and dissecting them from, skin to taking that skull and sawing it in half and really getting your hands on that body and learning the anatomy from that standpoint. Nothing beats the smell of cadaver lab and getting your hands wet and dirty and just really seeing those structures in firsthand. Then and only then can you really understand how the body works. So not only in anatomy did we learn the body parts, but in physiology we learned how the body works and operates. And we also did pathology lab. So we did venipunctures and we read labs and we did urinalysis, prostate exams, vaginal exams, eye exams, breast exams. We did all of these exams, which I am thankful that as a chiropractor, those were just building blocks of my education. I do not have to do those things in practice now. And now I use my hands to locate those vertebral interferences within the body. So you took that cadaver lab and now you're touching that spine, you're evaluating that spine, you're finding those subluxations within the body. And then by the chiropractic adjustment, you are performing that adjustment, you are releasing the pressure off of that nervous system, because that nervous system function is what drives our ability to do things. Without a fully functioning nervous system, our body doesn't work well. To you and me, that leads to symptoms. Are we getting headaches? Does our digestive system work? Can we function? Do we have good posture? Is our body working the way it should throughout the day? That's really why I chose chiropractic, is because it is this non-surgery, drug-free approach to obtaining and maintaining health. Because when you are in alignment, the power that made the body can heal the body. And it is through that proper alignment that the nervous system can fully function. So my patients' results speak volumes about the effectiveness of chiropractic care. It is safe, it is effective, and it is for everybody. And if it isn't for certain cases, those are very, very rare. Working with orthopedic doctors, sometimes we have to refer, sometimes we treat, and sometimes we co-manage. But it is having that knowledge base of what the body is supposed to do, how the body is supposed to work, that I have that confidence to be able to treat my patients when it is necessary. So chiropractic does work. Tell your friends.